Hello, my name is Dr. Anna Hemming. I am the founder and medical director of Thames Skin Clinic in Twickenham. I'd like to share with you some information about AviClear, a revolutionary new laser device that is FDA approved for the treatment of mild, moderate and severe acne. It's the first of its kind and it achieves amazing results. So why am I so excited about AviClear? Well, it's perfect for every single patient that has acne. From patients who cannot and don't want to take oral medication or where prescribing has become too difficult, to patients who are seeking a really good resolution with minimal downtime and amazing effects. So what is AviClear? It's a laser treatment. It's drug-free and we use it very simply in 3 treatments 1 month apart. They take 30 minutes each and we can apply it to all skin types. With hardly any side effects and no downtime, it's fantastic for teenagers right the way through to adult patients. We don't have to take blood tests and there's no contraception or eye pledge requirements. What's more, the satisfaction from patients is extremely high. It's an advanced technology engineered with a very specific wavelength, the 1726 wavelength that selectively targets and suppresses the sebaceous gland, reducing oil. To make things more comfortable, the handpiece is designed with a special AviCool sapphire cooling mechanism to it, and it makes the treatment extremely comfortable. The laser itself absorbs into the oils in the skin. This is a very selective laser wavelength with twice as much energy going into the sebum compared to water. It means it doesn't ablate the surface of the skin and minimises any kinds of side effects. Once the energy has absorbed into that sebaceous gland, it suppresses the sebum production. We're extremely lucky to have quite a large study for laser treatments with 104 patients enrolled in the US. This study follows the patients through their 3 treatments once a month and afterwards at 1, 3, 6 and 12 monthly intervals. The types of patients within the study are from all age brackets, acne severity, and different Fitzpatrick skin types. The clinical trial results share with us that 87% of patients have a reduction in their inflammatory lesions and nodules at the 6-month mark of over 50%. Now, when you compare this to other treatments, and bear in mind there are no significant adverse effects, no medication to be taken and no side effects, we don't need to use any kind of pain relief and none of the patients dropped out. That's quite significant. We also have really good 2-year data now with results that show that acne reduction continues to improve over time, even after the treatments have completed. When you look at the mean nodule count 6 months after AviClear has been delivered, there is a 93% reduction in patients who have moderate and severe acne, making it a go-to treatment for very severe acne patients. Compared to your traditional severe acne oral medication, where you can see at 8 months after starting the treatments, they have an 89% reduction. This shares with us the knowledge that AviClear is as good as, if not better than, the use of oral isotretinoin without the side effects, blood tests, and the effect on patients' mental stability. Looking at the side effects with this treatment, you can see that everybody in the study gets a little bit of erythema or redness, some edema and swelling, Some of them will get acne flare-ups, but this is transient. The skin does feel dry due to the preparation of the skin before the acne is applied, but that's very short-lived, and a few of them had a little bit of itching. But what you should also notice, that there was absolutely no pigmentation observed in the clinical trials, and there were no serious side effects either. Without any prolonged downtime, patient side effects resolved extremely quickly, from 1 hour up to a couple of days. So AviClear is clearly an advanced technology that we can all, in our practices and across the treatment of acne for all the patients who have it, can be shared. When you have a treatment with no pain, no topical anesthetics, that is comfortable to deliver, and it has the effect on acne that AviClear has proven to have, with just 3 treatment sessions, it's definitely something that I wanted to share with you. When you look a little bit closer at the histology, you can see the healthy sebaceous glands and the damaged sebaceous glands after treatment, whilst the epidermis remains intact, proving that it is the oil gland that is compromised without having any impact on the epidermis, reducing downtime. I would now like to share with you some of our patients' journeys so you can see how AviClear laser is applied and the effects on the skin afterwards.
Amelia, hi. You've just had AviClear treatment. Can I ask you what that was like?
I think it was quite non-painful, to be honest, with some of the other procedures or lasers I've done. Out of 10, I'd probably say it's like a 2 or like a 3. But yeah, I feel a bit dry right now, but I feel okay, during the procedure, and yeah.
Brilliant, okay. I'll explain the dryness to you in a minute. What are you hoping that the AviClear is going to be able to achieve for you?
Just to kind of clear out some of my breakouts, because I normally experience quite a lot of breakouts when I'm closer to starting my period, so I'm hoping it will kind of calm it down a little bit, maybe near my cheeks as well, and my chin. So yeah, most of mine is hormonal, so I'm hoping it dies down with this.
Brilliant, okay, well we'll be following you up, so we'll be really excited to see your progress. Thank you very much.
Amazing, thank you.
Julie, you've just had AviClear treatment. How did it feel?
Felt good. It was a bit spicy, as one of the girls said, but it was alright.
Okay, and how does your skin feel now?
It feels much better. It's it doesn't feel as hot as what it did when I came in, but yeah, it feels a lot better than what it was.
Good. Now this is the first of 3 treatments. What are you hoping your AviClear journey is going to bring to your skin?
I'm hoping it will basically just get rid of all the cysts and make it kind of smooth again. Is the best way to put it.
Yeah. Excellent. Well, we're really looking forward to following your AviClear journey, and we look forward to seeing you next time.
Thank you.
Julie.
So as you can see, patients tolerate the treatment really well. It's extremely safe, and the treatment significantly eliminates the acne in 3 treatment sessions. We will see some of the case studies in a minute. The results have been proven to be long-lasting, safe for all skin types and severities of acne with no downtime and very mild transient side effects. So here we have some of the patients that were given treatments within the acne trials. And as you can see, the patient's IGA scores improve. So from this patient at baseline to 3 months after their final treatment, the IGA score has cleared. Now we have someone with quite severe to moderate acne, different skin type, and we can see the improvement at 6 months, and this will continue over the next 6 months to improve, and we are following this patient up to 2 years. Again, the IGA score of moderate and almost clear 6 months after treatment. So what we're trying to share with you is the fact that you can use this on all skin types and the progression the patients will go through over the journey that they're on. Now, we do find that patients will have redness and may have some scarring after treatment. And interestingly enough, AviClear has been FDA approved for scarring. This particular patient, you can see that their acne is almost clear at the 2-year mark. As one of the first adopters of AviClear. We know that patients are very satisfied with their results, and most of them are highly likely to have the laser treatment again. Now, some of these patients don't want to have their acne again, so they're much hoping that they don't have to go through that process. So when you're identifying your AviClear patients, we really are targeting those between the moderate and severe categories. Now, you can use AviClear on milder acne, but obviously we get the much better results when the acne is more virulent. As part of the acne journey, we like you to talk to your patients about the possibility of treating their acne with lasers. You can also explain that there are no lab tests, no contraception requirements, and let them know the treatment has little or no side effects. Plus, it can be treated on any skin type. If your patients are interested in this treatment, we would be very grateful if you can provide them with our details and explain that they will need a specialist medical consultation with me or one of my team. We will assess the skin and then plan their treatment together. Once the patient is properly assessed, they can start their journey to clearer skin. If you want to scan this QR code, you'll find all of our details, and we'd be very grateful if you could share AviClear with your patients. And if you want to have a little look at some of the references used in this presentation, they are all written on this screen. It's been an absolute pleasure sharing AviClear with you today. If you have any questions or want to know anything more about the treatments we have on offer, including treatments that will help decrease veins, redness, pigmentation caused by acne, and our scouring treatments, please do get in touch. You can email us at info@thamesskin.co.uk, call us on 0208 150 3400, or find us on social media at Thames Skin Clinic. We hope you have a fantastic day and look forward to hearing from you soon.